Medicaid and the financial challenges it poses for state governments is one of the thorniest issues of the current health care reform debate. The Affordable Care Act greatly expands the number of people Medicaid covers, but doesn't exactly define what sort of health care they should receive. One of those concerned about how states may respond to this situation is Michael Chernew. He's a professor at Harvard Medical School and a member of both the Medicare Payment Advisory Commission and the Congressional Budget Office's panel of health advisors.
In order to reform the private sector health financing system, it was important to bring more people into the system, and that was done through a mandate, which is probably the most effective way to expand coverage. The problem is, once you have a mandate, there are low-income individuals that can't afford their coverage, and you don't want to can't essentially force them to pay for that coverage. As a result, you end up giving them a subsidy. Those subsidies tend to be expensive. In fact, in this bill, the subsidy is, roughly speaking, $900 billion over 10 years. That's expensive. There are concerns that I have that the subsidies will increase coverage, but because of a number of details of how this is paid for, you'll see certain programs cut back on aspects of that coverage, so people will have coverage, but the coverage itself might be hollowed out in various ways. I think there's some really fundamental questions that we haven't faced as a nation particularly clearly. One of them is, to what extent are we willing to tolerate differential access to care across different groups of people? In the current system, there is differential access to care based on income, for example, and I think that's problematic. Although it's not clear we can afford a system that provides everybody the same access to care. So a little more discussion of care and a little less discussion of coverage would have suited my taste well. A little more focus on what care we want this coverage to provide access to, as opposed to just saying, oh, you have insurance and so we can check off the box that you're good, would have been helpful. So I worry that our focus on expanding coverage has distracted us a little bit from expanding access to care. Certainly expanding coverage will improve our access to care, but it's not clear how much and what settings and for whom, and obviously the answers to that will depend on exactly how the reforms are implemented, and that's going to be on a state-by-state basis and remains to be seen.